Back when I was young, I had some pretty interesting friends. When I was in the 5th grade, I had one of my friends over for dinner, and she picked up her spoon with her left hand and started eating. I was confused because many years before she was right-handed, and you usually eat with the spoon with your right hand. She then explained to me that as a young child, she was right-handed, but then she had severe neural pain that made her unable to use her right hand. She then started using her left hand for eating and writing, ultimately becoming left-handed. Now, by the time when we made it to 5th grade, her right hand pain was gone, but she still continued to be left-handed because she could no longer write as well with her right hand. That got me thinking about why that happened. I thought that motor skills were fixed, since she learned how to write with her right hand. Little did I know that these skills are not fixed. They are malleable, like plastic. This ability is due to neuroplasticity.
This leads me to talk about what exactly neuroplasticity is. Simply put, it's the resulting physiological changes to our brain as we continue to interact with our environment. Essentially, the brain is perpetually reorganizing itself by forming new neural connections throughout our lives. By this mechanism, the organ carries out a process known as synaptic pruning, in which the neural connections that are not necessary are deleted, and the ones that remain are strengthened. In fact, because of this, the thickness of our cerebral cortex actually gradually gets thinner over time and evens out when we are around 20 years of age. Now, currently, this area of science is heavily researched, but interestingly enough, scientists used to believe that the brain stopped developing after the first few years of our life. However, modern medical breakthroughs have disproved this, and scientists have actually coined two terms to describe these broad ranges of change. First is structural neuroplasticity, which refers to the alteration of the strength of connections between neurons. And second is functional neuroplasticity, which refers to the permanent changes in synapses due to learning and development. Both these processes play a crucial role when the brain needs to recover from some kind of traumatic injury. Neural networks shift, allowing for remodeling and cortical changes, which can result in potentially permanent morphological changes.
However, sometimes when the area of the brain is extensively damaged, neuroplasticity cannot happen fast enough to regain functions, meaning the connections between the neurons cannot form as quickly. The brain might then turn to neurogenesis, which is the formation of neurons. The majority of neurogenesis usually happens during development, but it also takes place in the dentate gyrus of the hippocampus for the formation of new explicit memories and some neocortical regions. These new neurons migrate to those damaged locations to attempt to fix the connections and regain control of the functions. So over here is an example of Huntington's disease, in which in a normal brain, the ventricles are shaped like this and the basal ganglia has a size like so. But then in a Huntington's disease patient, the ventricles are enlarged and the basal ganglia and other neural tissue is atrophied due to cell death. In fact, according to a study in 1999, researchers at the Salk Institute in San Diego found a correlation between the rate of neurogenesis and the severity of neurodegenerative disorders like Huntington's disease, in which the basal ganglia neurons die, and these result in symptoms like muscle spasms.
However, not all plasticity is actually good for your brain. While most changes are associated with improved motor and cognitive processes, outside influences can also conversely negatively affect behavior and function. For example, a study published by the National Institute of Health in 2009 expounds upon the effect of drugs, where addiction integrates itself as sort of a reflex, which results in the perpetual motivation to actively continue drug-seeking behavior. Stress also has the capability of permanently altering neural networks and gene expression, and hence that's why it's so important that anxiety is never an omnipresent emotion in your life.
And so here is a diagram of a non-cannabis user and a non-cannabis user's brain and a long-term cannabis user's brain. And as you can see, the activity in the neurons is very different. But despite all of this, there is still hope. You can use neuroplasticity to your advantage to help your brain grow. Increased learning leads to a growth mindset, which is believing that you can do something difficult instead of giving up. By doing activities that increase neuronal connections and strengthening existing ones, you are exhibiting neuroplasticity. This is where the saying, practice makes permanent, comes into play. Because when you don't practice, then that certain skill goes away because of neuroplasticity. So, do puzzles or play challenging brain games that make you think outside of the box in order to take advantage of neuroplasticity. In fact, let's do that right now.
Okay, to give you an example, you have 5 pens for cows. What is the maximum number of cows you need such that each pen has 1 cow? I'll give you 5 seconds. You only need 1 cow. Let's try another one. How can you throw a ball as hard as you can and have it come right back to you, even if it doesn't bounce off of anything? 5 seconds again. Throw the ball straight up in the air. See, it isn't that hard to challenge yourself, to think beyond your usual work. All you need is an inquisitive personality who wants to take advantage of their brain's neuroplasticity. And most likely, at this moment, you would have made more connections than at the beginning of this talk, all because of said neuroplasticity.
So thank you.